Here.
Ebola is a very popular subject with everything going on in West Africa and Dallas now, with some cases in the United States. We all have to assume that it's possible for a patient with Ebola to show up at your doorstep. Being where we are near Charlotte and International Airport, it's a distinct possibility. So we've put in place some policies to help us manage a patient should they show up here with potential risk of Ebola infection. We were screening for that possibility and have process in place where they will be isolated and precautions taken so that we can avoid any transmission to other healthcare workers, people in the community. We have been doing drills to try to help make sure we're up on the process of putting on protective equipment and taking it off so that we don't contaminate each other. We're also paying attention to the national picture and conversation, knowing that the CDC is recognizing that they'll have to be involved should someone show up in a small hospital like us. We're also preparing for the flu, and the flu season is just on our doorstep. The risk of the flu for your average individual, of course, is higher than something like Ebola, but we in the healthcare industry have to take the Ebola threat seriously, but at the same time we're also trying to teach everyone, take care of yourself, get your flu shot, prepare yourself for the flu, and be aware that more people die of the flu every year than die from Ebola. It's important to think, if you become ill, just use common sense initially. What am I at risk of? Did I just go see a relative who was a bit ill? Well, it's probably the flu. If you haven't done any extensive travel, especially to places in the world that are known to be hotspots for Ebola, then you're probably not at risk for Ebola. So just keep in mind that you have to be around someone with Ebola, which means you either have to travel to some place in the world that is known to be a hotspot, or be around someone who has traveled. So keep in mind that those factors are very rare in this part of the world, in our neighborhood. So around here, if you start feeling ill, you probably got the flu. I doubt you have Ebola.